Well, hello and welcome. My name is Jeremy Wilkes. I'm a science reporter at Euronews, and we are partners in the European Health Parliament. And I'd like to welcome our guest, Vice President of the European Commission, Margherita Schinas. He's in charge of promoting the European way of life. Thanks for being available for this interview.
Thank you. Thank you for having me.
I'd like to start by asking you to take a step back and look at 2020 as a whole and to look at the way that healthcare systems reacted around Europe to this pandemic. We saw flaws and inconsistencies, a lack of preparedness. What do you think are the big lessons that we can take away from that so far this year?
Indeed, I think it's the right thing to do is to look back. And if one looks back, then can distinguish, I would say, three stages of our systems coping with the pandemic. The first was, let's not hide it, a stage of lack of coordination. The natural instincts of our governments were to sort this out as best as they could by organizing themselves at a purely national level. We have lots of decisions at the time that didn't make much sense in terms of borders, in terms of reserving equipment and medicines from the cells. This didn't work out, and everybody found out that this was not the right thing to do. Then stage two, I think, is when our member states gradually discovered the value of interdependence. They saw how much they have in common: the single market, our supply chains, the need to ensure a flow of people and goods that kept our supermarkets stocked. So this second stage, I would say, was the stage where convergence started to emerge. And then we had the third stage, which was eventually when everybody in the European Union understood that the only way to cope with this unprecedented crisis is through cooperation and by taking important steps forward in terms of integration. So in a nutshell, we started separate, then we converged, and now we're coordinating.
Were you surprised by that first stage, the fact that there, after so much work to break down borders and to create this wonderful EU that we're able to move around in, suddenly frontiers were coming back and we seemed to go back in time? Were you surprised by that?
Yes, I was surprised, but let's be honest. Our member states' early reaction was quite similar to the reaction that many of us had as individuals. Well, not myself, but many Europeans thought that by storming the supermarkets and buying toilet paper and food supplies, they would somehow survive the pandemic alone. And this lasted for a week or so, and then we all saw that this is not the way of going about things. We have a threshold of expectations from the European Union. We have the biggest and best regulated market in the world. We are cohesive, values-driven societies. We very quickly found out that this was not the right thing to do.
What would you like to see in terms of innovations and preparedness for the future? Do you think there's an expanded role for the EU? Or do we need to have an expanded role for the European Centre for Disease Prevention and Control, European Medicines Agency, some other kind of institution that we invent?
Well, first of all, another thing that we saw last spring was what I like to call an asymmetry of expectations, a gap of expectations. Many Europeans were asking from Europe to do things in areas where Europe does not have the legal competence to do it. And health is a typical example of this gap of expectations, but not the only one. Education is another one. Tourism is another one. So in all these areas where we do not have legal competence, people expect us to do a lot more. So one of the lessons that we learned from the crisis, that bridging this gap of expectations is very, very urgent.
So how do you do that? What do you need to create to do that?
Well, as you know, this already started with the comprehensive historic recovery and resilience fund and the next generation EU package that in a way builds into our system the necessary resilience in key areas where we need to do more and better. Health being one of these areas with a new self-standing EU for Health program. But this is not only enough. We need to move beyond that, and we need to take a closer look to our agencies, the European Centre for Disease Control, the ECDC, and the European Medicines Agency, because these agencies were structured for the good times, and now we have seen them tested in the pandemic time. So we need also to adjust their missions, their status. So quite a lot of work to do ahead.
Okay, so you would like to see some kind of change in their mission. Can you give me some examples on that? What kinds of things that you'd like to see?
Yes, I would like to see, and of course, since we'll be presenting proposals, I don't think that we need to be very detailed at this time. But
No.
what I would personally like to see is for these agencies not to be some sort of registries or notaries of the situation developing around us, but a much more proactive, standard-setting agency that helps our member states, helps our governments to move in a way that converges in their health systems. The Medicines Agency has a different mission. In a way, they are doing this already because they are involved in market authorizations. But for the ECDC, I would clearly like to see a more dynamic, proactive role that steers and coordinates rather than registers the situation around us.
On a political level, do you think we can manage to create better coordination in the future? Because it does seem to be that we had an extremely uncoordinated response. What's the feeling inside Brussels related to that? Was there a lot of frustration actually, inside the Commission at this lack of coordination between member states and lack of solidarity, really?
Yes, there was. There is no doubt there was, and it was totally unfair that a part of the blame, if you like, was shifted towards Brussels on things and areas and tactics and measures that were not related to the European Union. They were purely national measures. Now, there are two positive elements in all this for the future. One is that our public health systems in Europe proved their resilience and their value in the overall value system of what the European Union represents today in the world. I think public opinion saw that we have systems that can deliver in difficult times, okay, with problems, with difficulties, but overall, I think the overall judgment for our public health systems in Europe is we're so lucky to have them.
Yes.
And the second thing,
there was no lack of appreciation, I don't think, at all.
But you only appreciate things that are tested under extreme circumstances and deliver. And the second positive news, I would say, is that there is a growing, emerging political consensus in all our governments, in all our member states, on this notion of Europe that protects, which is something that, as you know, Emmanuel Macron coined first in his Sorbonne speech. Many people were asking themselves, what is this about? Well, now we know what is this about. It's preparedness, is resilience, is autonomy, is independence from your competitors in key areas, and that's what we'll be working for in the years to come.
Talk about vaccines. Do you think the vaccines that's going to beat COVID-19 is going to come from Europe? Where are we with that at the moment? What's the insight you can give us?
Well, one of the most tangible ways to show that Europe has learned the lessons of the pandemic and can work on terms of resilience is precisely our vaccine strategy. We are not in charge, of course, of the research, but what we can do is to make sure that we buy with advanced purchasing agreements from all these companies that were advanced, that are well advanced into the research towards the vaccine, so that access to the vaccines will be universal and will cover all Europeans. All Europeans will have affordable and equitable access to the vaccines.
So you can reassure us there's a kind of a plan in place as far as that vaccination, because I think a lot of people are worried about that. Are they going to be able to get there on time? How many vaccines are they going to have to have? Are they going to have 2 injections or whatever? How on earth do you roll that all out?
Yes, there is a plan, and this time we will not see what we saw in the early stage of the cacophony around the personal protective equipment. This time we have a centralized EU approach. We have money for this, and we are well advanced to allow all Europeans to have access, affordable and equitable access to the vaccine.
One of the recommendations that's being published by the European Health Parliament today is calling for empowering citizens to be able to take advantage of cross-border healthcare opportunities. Imagine that we're in a world where we've got the borders as they were last year, open and free. How do you react to those kinds of calls for people to be able to go and get treated in other countries and to move around? It's something we hear talked about, but I'm not sure how much of it's actually happening on the ground.
First of all, on a more general level, let me tell you how much I appreciate the involvement of our youth in key areas of policy. We saw this with climate change, and it's so encouraging to see young Europeans engaging in shaping the future of our health policy. So well done to everybody involved. Now, on the cross-border dimension of health, you know that we already have several mechanisms in place to facilitate cross-border health opportunities. We have the Cross-Border Healthcare Directive that allows for EU citizens to be treated in another member state and be reimbursed at home. We also have the so-called European reference networks, which is an initiative we created to bring together specialists from across Europe to share resources and knowledge on complex and rare diseases. And looking forward, we will come up next year with a new European health data space, which is crucial in our, amongst other things, in our Europe Against Cancer plan. So there is a panoply of tools and instruments that are available, and we will be engaging more in this healthcare, transborder healthcare provision.
You touched on data there being something that healthcare systems are very keen to get their hands on. We have seen, I think, generally a generational split between younger people who are quite happy to share data, anonymized data, and then older people are a little more reticent about that. In light of what's happened with the pandemic as well, lots of conversations about e-health and digital health and sharing of information to try and solve problems. How do you see the development of healthcare related to those sorts of things, sharing information across borders, sharing information in a digital way? It's not really what I grew up with, nor you either, but how do you see it developing in the future? What would you like to see happening?
Let us be very honest. We will never have in Europe opportunities for cross-border treatment and care, and for meaningful responses to chronic, to big threats, health threats, without some sort of health data space. This is a starting point. But of course, we are the European Union, and we will do this the European way. You know how our American friends go about these sorts of questions on data, and you know that in China, for example, these questions are not even put. We are the European Union, so everything we do in this area will have to, of course, maximize our potential to effectively address these issues, whilst ensuring the protection of personal data and intellectual property. This is for us, these are red lines for the European Union. So I agree with you that there is a generational issue there, there is a conceptual problem, but if we were to move to this stage, we would have to do it the European way, but still do it. It would be life-changing for many people.
Moving on to some of the other healthcare challenges that we have, the EU has made a lot of noise about battling cancer, but now everybody's really, the top of mind is coronavirus. Do you think people have taken their eye off the ball a little bit with some of these other big societal challenges?
Well, look, there is no doubt that the pandemic clearly had an impact on cancer. The way that many treatments have been postponed, the way access to the hospitals has been regulated in our member states, and that's in a way it's not surprising in itself. But having said that, I want to be very clear that our work in this European plan against cancer, which is one of the most emblematic proposals of the von der Leyen Commission, has not stopped. Quite the contrary. We have been very active with my fellow commissioners to speed up this work. As you know, now we are completing the consultation process, which we launched pre-pandemic times in February. We had the time to do it in a very touching and emotional ceremony in the European Parliament. Then we used these past months to advance the consultation, and now we'll be ready for the end of the year to come forward with the action plan. And I want again to take this opportunity to tell everybody that this will be a holistic approach. It will not be a patchwork of things to do. It will be a single, united, cohesive framework with all actions being interwoven in a way that we can mobilize as Europe everything we have at our disposal. And I hope that this will be the beginning of one of the most effective policy responses to this scourge.
Well, thank you very much for joining us. We've run out of time there. Vice President of the European Commission, Margarita Schinas, thank you very much for being with us in the European Health Parliament. We'll carry on talking about some of those topics in our panel session to follow. Thanks very much for being with us today.
Thank you. Thank you.